E te ti, e te tā, no mai rā. Firstly, I want to apologise, everyone, for the slight delay in us joining you for this afternoon briefing. I'll be frank, my computer froze, something that happens to all of us at the best of times. As you will have seen earlier today, there are 22 new community cases to report, 3 of which are in Whakatiwai in the Hauraki area and the remainder in Auckland. Just a brief recap for those who may not have familiarised themselves with the Ministry of Health's update here. Of the cases reported today, the majority are household or known contacts. 5 are unlinked. 3 of these, though, are within one family, and we already have a tentative link for this family. Interviews are underway, and we'll give you a further update on this tomorrow, but as you will have seen in the past, we do often link these cases in time. A few more details on the Whakatiwai situation. We have tested in and around this case and continue to do so. Of that testing, which has included so far household contacts, correction staff, court staff and police staff, we still only have the 3 positives that were reported this morning. We are continuing with widespread testing in the community where these cases reside. Testing sites have been set up today to assist with that, and over 300 swabs have already been taken in what is a relatively small community. At the same time, though, we do want to make sure we are keeping the community safe while we identify contacts and so on. For more details on the steps we are taking in that regard, I am going to hand over to Dr. Bloomfield. Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So, in addition to the testing and contact tracing and isolation that's already in place, I am going to put in place a Section 70 notice, which will place some requirements on people who live in an area north of Highway 2 and centred on Mangatangi, and that will effectively extend the road boundary to the east of, just to the east of Maramarua, and also just to the southeast of Miranda on the Firth of Thames. And so people who live north of those roads are required to do the following things. What I'm going to do in the Section 70 notice is essentially ask people who work there or live there or who have visited households there since the 8th of September to remain at home and to monitor for symptoms. Some of those people will, of course, already be involved in the testing that is happening of the school community from Mangatangi School or the marae, which is in the town where these people stayed. So I'm asking those people, again, who live in that region or who work there or who have indeed visited it since the 8th of September to stay at home and monitor for symptoms. The only reason you should be going out is effectively to get food or other essential supplies or to seek healthcare. That is proposed to be for the next 5 days, no later than Friday, but it's just as we get testing done. Some of you may be asked to be tested as we find locations of interest. And so one of the things I'd like people to do who are in that region is to monitor the Ministry's website for any emergent locations of interest. And if you have been at one of those, to follow the instructions. Testing will be available there in that area, and we will, of course, publicise where that testing can be got. So we will put that Section 70 notice up a bit later today, which will include a map of the region that is involved.
Thank you, Dr. Bloomfield. And my understanding is that the police will mirror that Section 70 in the way the placement of boundaries around those areas. So essentially the approach that we have taken here is a bespoke level 4 lockdown requirement for an extended area around where those cases reside and where that community congregates around, including the areas where the school predominantly services. The reason we've used both a boundary approach and a Section 70, that means that we're able to cover those who might not live in that boundary, but who come in to work in that area. So we cover both our bases by operating in this way. It gives us that extra layer of comfort for both the community and those service towns around that community that we are creating a level 4 environment for those most likely to be affected for a period of time that allows extensive contact tracing and allows extensive testing across that community. For now, though, I do want to thank everyone locally to date who has been involved moving quickly on this. Your help has been greatly appreciated. We have been thrown curveballs before in outbreaks, and this is one where a strong local approach will make all of the difference. So again, my huge thanks to everyone in the region who's been supporting the response, which includes our public health team in the Waikato and the Auckland area. Now, I'll come back to our status more generally. We're now 1 month and 4 days in from when we learned of the first case in this outbreak. We now know Delta has been present in the community for a week to 10 days prior to that first case, and multiple chains of transmission were already established. With Delta, we knew we couldn't take chances, and the immediate move to level 4, initially to understand the breadth of the outbreak and then to get it under control, was the right move and has worked. Modellers tell us that had we waited just one more week to act, we would be sitting at around 5,000 cases by now. So to everyone, but especially Auckland, thank you for acting quickly and for persevering. We know that level 4 has been tough, but we also know it's made a difference. Since the outbreak began, we've identified 39,637 contacts, carried out almost 670,000 tests, administered 1.43 million first doses of the vaccine, and provided a further 660,000 people with their second dose. Almost all cases in the last 14 days have been household or known contacts of existing cases. And we are confident, as has been conveyed to us from the local public health team, that there is no significant undetected transmission. But Delta does have a long, hard tail to it. And the question we discussed as a cabinet today was, what is the best alert level we can use now to continue stamping out cases? In considering this decision, we looked at the details behind recent cases, and here are some observations. For the most part, we haven't had widespread issues with workplaces. Where we have had cases at work sites, these have generally been close contacts of existing clusters who have then gone on to infect work colleagues before they were a known contact. Workplaces, for the most part, had strict protocols in place and have moved quickly when cases were identified within their work site. This tells that this approach remains really important going forward. Another important observation is that of the cases where we've been able to establish a link, none have resulted from people accessing essential services. This tells us that infection prevention controls like masks, distancing and limited travel have all been incredibly important and must continue to be used. And what everyone will have observed is the final point, that where we have had cases, they have been dominated by close contacts, mainly household contacts, and in some cases, secondary households with other family members. That is why the next stage of our plan must continue to be to keep bubbles tight. This is key. And all of these features are part of level 3. These observations taken together has helped inform the advice of the Director General and Cabinet's decision today. That advice explicitly stated that level 4 has done what we needed it to do. It has helped us contain the outbreak. And now as we continue our zero tolerance approach to cases, level 3 still provides the really important and strict rules that help us keep up that important work. Therefore, we have accepted the Director General of Health's advice and confirmed that Auckland will move to alert level 3 at 11:59 p.m. tomorrow night, Tuesday the 21st of September. The Director General was also clear that given the long, hard tail of Delta, we will need time here. And Cabinet has accepted his advice for Auckland to stay at level 3 for at least 2 weeks, with Cabinet first reviewing those settings on Monday, the 4th of October. As for the rest of New Zealand, as I outlined on Thursday last week, for so long as Auckland is at the higher alert levels of 3 or 4, a greater level of preparedness is needed elsewhere. In other words, level 2. You will have heard me signal last week, though, a view that with Auckland's move, there is an ability to allow one more minor change for the rest of the country, around the number of people who can gather together at level 2, including in hospitality venues from 50 to 100, and Cabinet has confirmed that decision today. In terms of what level 3 means for Auckland, I can sum it up with one word: caution. You will have heard me say that when analysing where transmission has occurred, there are some strong themes and reasons why certain rules remain in place. They stop transmission at level 4 and are still in place at level 3. First, your bubbles remain. You are not allowed to visit friends or neighbours at level 3. You shouldn't join them for food, talk closely across the fence, or even have children play together. I know this is strict and it is hard, but it is there for a reason. You are allowed to make very minor and small extensions to your bubble to bring in a person who may be isolated and vulnerable, such as an elderly relative. If you have care needs for children or the vulnerable, you may bring in another family member or carer to help. But please, these are very tightly controlled extensions here. No matter what, your bubble must remain small and exclusive. These are the same rules that we have had in the past. We have seen in this outbreak COVID being spread between households. Once in a household, everyone is at risk of getting Delta. So if you break your bubble, know that the consequence may be spreading COVID back into your house, to your family and your loved ones. Please take this rule seriously. It's not until we get to level 2 that you can essentially have contact with others. More businesses can open at level 3, but only in accordance with strict rules. And I do ask businesses that reopen to play their part in reopening safely. Put in place all of the necessary health and safety rules. Make sure you look out for your staff. If any of your workers show up with cold and flu symptoms, please send them to get a COVID test and support them to stay at home until they are well. And please encourage and make time for any staff member not yet vaccinated to get vaccinated. In fact, make time for them to do this week. The best way to keep moving down alert levels and for businesses to stay open is for sick people to stay at home and for everyone to be vaccinated. For everyone else, keep working from home if possible and keep children and young people at home with you where you can. Remember, schools are broadly speaking closed. They should only be going to school if parents must go to work and there's no other option available. You recall that this is the same setting we've always had for level 3. For the most part, schools and other learning centres are closed. In the rare instances where children are in a school environment at level 3, Cabinet today agreed to make face coverings mandatory in all level 3 high schools in all indoor settings such as classrooms and assemblies. This is an added precaution. Again, this is for level 3 high schools. Again, it will be very rare that anyone is in attendance at these schools, but where they are, we have a mask requirement for them. Events and gatherings still cannot happen without except for the extraordinary exception of 10 people being able to gather for a civil union wedding, funeral or tangihanga. Again, that is in extraordinary circumstances. And a reminder, because Delta has changed the rulebook, we have had to change how we manage it. Here is an overview again of those changes. Contactless delivery and pickups can occur, but all staff and customers are legally required to wear a mask for outwardly facing businesses. So when you pick up something in a contactless way, everyone should be wearing a mask. In fact, everyone is strongly encouraged to wear a mask in any indoor setting with people outside your bubble. The latest science tells us Delta spreads very easily, often through the air, so masks make a real difference. I'd encourage all businesses to familiarise yourselves with all the level 3 requirements. Meanwhile, business owners and operators can now access their premises in order to prepare for contactless opening, including to meet the public health requirements. I now have a particular message for those listening who are over 65 and especially in Auckland. For you, level 3 poses a slightly higher degree of risk, and that is why I'm stepping up my level 3 advice for anyone over 65 in Auckland. If you have not yet been vaccinated, please stay at home until you have been. This will give you an extra layer of protection in this outbreak. We have been doing direct outreach to all our over 65s who haven't had their first dose yet in Auckland. That amounts to about 23,000 people. The vast majority of over 65s have been vaccinated, but for the smaller group, we really do want to encourage you to take that next step. Last week, a letter was sent to those over 65s who we had details for. Today, we're commencing an outbound call campaign. Healthline have started calls this afternoon to support our older New Zealanders to be vaccinated. These will average about 8,000 calls a day. If you get a call, please take the opportunity to ask any questions or raise any concerns. We have people on the end of the line who can answer them for you and help with the booking and support you to be vaccinated. If you have a booking that's a way off in the future, please bring it forward. There are plenty of spaces right now. We've only asked our oldest people specifically to stay at home once before. It was when we didn't have a tool to protect you. It was right at the beginning of lockdown. Now we do have a tool, and I'm asking that you please use it. If staying at home makes you feel anxious or distressed, please reach out. Many pharmacies are doing medication deliveries, and the Student Volunteer Army grocery delivery service can help you access food. Aged Concern can be contacted for general advice and support. Their number is 0800 65 2 105. If you just need someone to talk to, and this message is for anyone, please at any time use 1737. Finally, quick reminder on the boundary rules, and then we'll open up. These are tight for a reason. Most people are not permitted to travel. If you have permission to travel regularly, such as for work, you need to have evidence of having a test in the last 7 days. Again, this is for travel over the boundary. The rules are different for people permitted to travel for personal reasons. You must now carry evidence of a negative test result within 72 hours before you travel. There is an exemption process for emergencies through the Ministry of Health, and this is work we've been signalling for some time. My final word. We are not stepping out of level 4 because the job is done, but nor are we moving because we don't think we can achieve the goal of stamping out COVID-19. We are moving because level 3 still provides a cautious approach while we continue to stamp out COVID-19. It means staying in your bubble. It means contactless transactions and keeping your distance. It means we say thank you to Auckland for their tireless work, and we collectively keep going. Happy to take questions. Jessica.
If you are comfortable with this number of cases and you say that we are still restricted enough under level 3, why not go to level 3 earlier?
Well, essentially what the decision we made at that time was that doing that extra piece of work gave us that extra time to continue to assess whether indeed we had that containment we believed we do. The public health team has given us their view that yes, that continues to be the case, that we do not have widespread transmission or uncontrolled transmission in Auckland. That was why we made an in-principle decision last week and why we've followed through on it today.
With the number of new cases, 20, 24 and today 22, is level 4 really working?
Oh, look, level 4 has done the job we needed it to do, which was right at the beginning when we had only that one case, getting a sense of the degree of the transmission we had, and then establishing as much as possible a ring around it and ensuring we did not have widespread undetected transmission. Level 4 has done that. Now we need to keep going. Level 3 is not a situation where we are broadly opening up. You stay in your bubbles, distance is kept, schools remain, broadly speaking, closed, and we keep doing the job of stamping out COVID.
Can you elaborate on your closing comments? Do you genuinely think you can still eliminate COVID, eliminate Delta under level 3?
I think it's important to remember that actually level 3 has been the place we have moved to first for every other outbreak that we have had to date other than the first one. The reason we went to 4 first was because we saw in other states in Australia how quickly Delta moves. So we moved quickly to establish how widespread it was, get that broad containment, and now we need to keep going. And I'd really highlight again, 3 is a continuation of stamp it out, not a cutting loose of those restrictions.
Despite those heavy restrictions in level 3, people are still going to be concerned that the outbreak's going to potentially blow out under level 3. What assurances can you give, and can you also commit to not yo-yoing back up to level 4?
Well, you will have seen from the observations of where we've had transmission to date that ultimately all of the protections that level 3 provide will continue to be important for us, and were important in level 4, and they're all still there. We don't want people intermingling with others. We want those protocols of infection prevention, masks, distancing, all to remain in place, and level 3 does that. And we still restrict people's contacts. Schools don't open. You can't go into eateries. It's all contactless deliveries. That remains critical, and we asked everyone to play their part because that will continue to help us with case management.
Are you rolling out a yo-yo back up to level 4?
Look, we're moving now because the advice we have is we do not have widespread transmission across Auckland. If everyone continues to play their part, we can continue stamping out. Dr. Bloomfield, you might like to give your comments there, though. It's ultimately your advice.
2 comments I would make. First of all, as the PM has said, good evidence from a range of sources that we don't have widespread undetected transmission in Auckland. Wide testing, we've done some modelling. We're very confident there's not a pool of undetected transmission happening there. We are still getting cases come up, and often they are unlinked initially, but we are then able to link them back to specific cases. They're also centred geographically, they're much more confined to that South Auckland area. So whereas when we gave the advice to remain in level 4 most recently, we felt we had some still quite rough edges of the outbreak. We think they're not as totally smooth yet, but much smoother than they were. The second comment I would make, and again this reiterates what the Prime Minister has said, elimination is about stamp it out. It's about zero tolerance for the virus in our communities. And that's what level 3 is about. The difference this time is it's level 3 with high and increasing rates of vaccination. And so it gives us further opportunity to get those vaccination rates up even higher.
The vaccination rate element is important. We haven't had that tool in behind us supporting our alert level restrictions before. We do now. We just need as many people as possible taking up that vaccination opportunity, and in particular, our most at-risk New Zealanders. It is a crude way to identify those individuals, but we do know the risk is higher for our older New Zealanders, which is why I have singled out our over 65s in this announcement today. A small number have not yet been vaccinated. We're asking them, please be vaccinated, and until that time, keep yourself safe. Gina.
Just to clarify, that means stay at home, no access to essential services.
It's exactly the same call as we made when we very first went into restrictions. At that time, we did ask our older New Zealanders to keep themselves particularly safe, and if possible, to use others to access essential services like food and pharmaceuticals, but of course to continue their health appointments. Here, what I'm asking again is until they have sought and received vaccination to take up a similar approach, to utilise those around them who are able to support them with access to food and medication. But in person, they should, of course, still attend their health appointments and, of course, be vaccinated.
Why was that move not made at level 4?
Well, we've actually, in level 4, essentially everyone's staying at home except going out for groceries. What we're acknowledging here is that with level 3, we will have a bit more movement. And so with that more movement, we are asking our over 65s who haven't been vaccinated to be particularly cautious. And the best way to be able to move in a level 3 environment safely is to be vaccinated. So this is a very specific call to the roughly 20,000 who have not been yet to please be vaccinated.
And Dr. Bloomfield, epidemiologists say there's a good argument for primary school children to wear masks. Can you clarify the current rules around that, and would you be willing to make it mandatory for those younger school children?
Well, it would be Cabinet would make it mandatory. At the moment, our advice is to encourage it in primary school children, and for alert level 3 in Auckland, where there will be a small number of students going to school, to require it for secondary school students.
I guess with what we've seen with the children in a level 2 environment at the Waikato school, did that give you pause for thought to make it more widespread among younger school children?
Not at this point, no.
So, Dr. Bloomfield said that under level 3 there's still a zero tolerance approach to COVID-19. Are you saying that that Auckland can't move into level 2 until there is 0 cases in Auckland or a prolonged period of 0 cases?
Of course, the whole point of the zero tolerance approach is not that you'll have 0 cases, but rather you take an approach that wherever those cases arise, you are aggressively contact tracing and seeking to stamp them out. And that has been our approach all the way through and continues to be the approach that we are taking at level 3.
So what does that mean in essence?
It means that there's no change. We've always said zero tolerance does not mean 0 cases. It means stamping out cases where they are found. You'll also see in the level 2 framework, essentially what we're looking for there is greater containment. That's always been the description down the side of the alert level 2 framework. We would want a level of comfort that we had those cases well under control in a level 2 environment. So that's why we've said, look, we don't believe we'll be there in anywhere within 2 weeks. We're giving giving the certainty for Auckland that it will be at least 2 weeks.
Expand on that level of comfort, because there would be people watching this looking for some certainty. Does that mean 4 days in a row of under 5 cases, or just some inkling of...
No, because as you've seen, Jason, today, I mean, the vast majority, a larger number, but the vast majority, again, household and close contacts. One of the realities we're facing is that some of the households affected by COVID-19 have been families, larger families, and that's been devastating to see, but it's also, again, why just taking a raw number approach doesn't tell the full picture, and I've said that repeatedly at this podium, so you know that rant well.
Auckland can go into level 2 if there is still COVID in the community.
We would want to be of the view that we were in a situation where we were well contained. At the moment, we continue to see mystery cases that are cropping up through community testing. Rather than us getting out in front of those, we'd want to see a turnaround in some of those situations, because that gives you cause to consider that even while we've retrospectively been able to link, that does pose some risk that individuals have been infectious in the community. Well, that's been certainly our goal all the way through, and if every single eligible New Zealander goes out and takes the effort to be vaccinated, that's the best thing we can do to ensure that it will be.
So if vaccination rates are high, you think Aucklanders, and in fact New Zealanders...
High vaccination rates will undoubtedly be a game changer for New Zealand, but the key there is high. You will have seen a lot of discussion overseas at the level of restrictions that are still in place and the level of hospitalisations where we have lower numbers. You will have heard Dr. Bloomfield say he's aiming for 90 plus of eligible New Zealanders. So that's the range in which we want to see people aspiring to. That's the kind of range that means we have fewer restrictions. We will take the opportunity over the course of the week to delve into a little bit more detail as to what that modelling is showing us about what vaccination rates mean for restrictions in the future. And that will give everyone a bit of insight into the information we're receiving. So we'll look to do that over the course of the week.
So what answers to...
just on the prisoner.
Yeah.
When he was released on bail at the residence in Perth and Thames, how did he get down there? And did he go straight there? Or are we not confident that they didn't stop on the way?
Well, so the first thing I would say is that we have knowledge of every stop and movement, because this was someone who was on bail who was being GPS monitored. So that's the first thing, and that's useful information for us as we contact trace. One of the bail conditions was that essentially they needed to be transported by a specified person to their residence for their bail to be carried out for the period on which they were on bail, and that they more or less needed to take a direct route to that environment. What we're trying to ascertain is whether or not that person who was directed to take them there did follow through all the way in taking them to their bail address. But what I can tell you is once they arrived on that same day, they did stay there for the duration of their bail.
So really, the germane bit to this case is the more or less part.
So the germane bit to this
more
case...
direct or less direct?
Yes, and also whether or not the person who is linked to the cluster actually was involved in transporting that prisoner. So that's the part that we are working on the detail around. So just to be clear, someone is able, once they are bailed or released from prison, to go back to their home residence for good reason. We treat them like MIQ. They've been in an environment where they've not been exposed to COVID. And of course, Mount Eden is a remand prison. It will have a number of people from outside that region, and they need to get back to their place of residence. Bail conditions set basically say you have to go back to that address. What we're working through is whether or not that person fulfilled their conditions with in the time it took for them to get there that same day, and fulfilled their conditions by the way that they were transported there. There was a small number of people that took them to their place of residence, and so that's what we're working through.
And who's doing that? It's a mixture of corrections, police,
Yep,
MOH?
corrections, across corrections and police. Ministry of Health are only interested for the purposes of contact tracing those involved. But we have a reasonable picture of what's occurred here.
We do. One thing that is material is that during that journey, that predated this person's infectious period.
Yes, so they weren't infectious at the time of their trip back to their bailed address.
Does that tell us that the prisoner perhaps got infected from others living in his household?
No.
Have you established that yet, Dr. Bloomfield? Was it the prisoner who infected his household members?
Yes.
Or their household members?
Yes, it seems we're still waiting for the whole genome sequencing on all the people involved, but it seems likely that the person who was on remand was infected by someone who had been in Auckland, probably one of the people who transported him south, and then as a result of, as he was required to, remaining at home with the other members of the whānau, he's infected other members of that whānau.
Potential epidemiological link to the person who discharged themselves from Middlemore Hospital?
Not at this point,
no. But we believe from genome sequencing and others that we have a reasonable understanding of what has happened. What we're trying to do is place this individual in the timeline. So it was within the bail conditions of this person to be supported to travel to their bail address. Someone needed to drop them off. So what we were working through is which of those individuals involved in that drop-off were was the infected person, at what point did they join the journey, and whether that was outside their bail conditions.
Did you not know that this person's household was in a level 2 environment when answering questions yesterday?
Because there were 2 sites that we were given involved for this bailed person. One was inside the boundary and one was outside the boundary. The important point being, however, it would not have been against the rules for someone to be bailed to an address outside level 4. What's critical is to restrict the movement of coming and going for that individual.
Did they return a negative test before they were sent out into level 2?
No, but they had been in prison for well over 14 days and there was no COVID in the remand prison. It's very clear that this person has become infected with COVID from someone that's been involved in their journey to their bailed address.
So then did the person who transported them, did they break the level 4 boundary?
Well, if they were involved with transporting a prisoner, not necessarily. And this is the level of detail that we're working through at this point.
Corrections, not just transport them?
I'd need to ask that of corrections. I don't believe it's necessarily the case that every prisoner, once they're bailed and GPS tracked, is then individually dropped off by corrections. But it is
a Delta
part of
level 4
their
outbreak.
requirements. It's set out in their bail requirements how they are meant to behave as they transfer, and the rules were that they were meant to be directly dropped off. So we're working through some of that as well. Keep in mind the primary consideration for us here is contact tracing. We need to make sure who is in contact when, who is at risk of having COVID when. Secondary to that, we want to see whether or not rules were broken and if we can tighten up the procedures there, and we're doing that at the same time.
It's taking so long to check the GP.
I'll just get a little bit of order back into the line of questioning. Better, then I'll come to Ben and Mark.
Prime Minister, you say that it's contained, but why are we still getting these mystery cases that are linked after the fact? Surely, if the contact tracing is doing its job, they shouldn't be surprises.
We've said that we haven't got large-scale undetected transmission. And so essentially what that means is we are still seeing cases emerge where someone may not have identified contact with someone, but which we are able to link them. So we know that basically we've already identified for a large part where the cases exist, and then are able to connect those individuals to those cases.
How can you be confident that it's contained when there are contacts which you don't know about?
We're confident there is not widespread undetected transmission. There is ongoing work to do to stamp it out, which is why we're at level 3. You might see another decision if we thought we were further ahead than that.
And to Mr Bloomfield, what is the R level at the moment? Is it the 0.4% referred to by Sean Hindy?
0.4. It's still well under 1, and we can see that, again, just to point out that the vast majority of our cases each day are known household or other contacts. And for example, 10 of the cases that are in today's number were already in an MIQ facility. So that's they were tested because they were symptomatic or it was their day 12 test.
I had Ben.
Prime Minister, what's your modelling saying in terms of where you expect cases to go now over the next fortnight?
That would be a question for Dr Bloomfield.
Yeah, to continue to, my colleague in Auckland uses, rumble along a bit, but we're just expecting them to decline. One of the things we're going to do is to give an estimate, and I did it at one point last week, of the sort of expected number of cases that may still come through based on the size of the households where we're getting new cases and the conversion rate that we see. So the number of cases we would expect, and that will change each day, but we will give a range of the cases that we're expecting still to come through from our known contacts, particularly known household contacts.
So
I said I'd come to Mark.
The level 3 lockdown is...
Oh, sorry, I said Ben and then Mark, didn't I? Forgive me, Ben.
That's all right. The level 3 lockdown is obviously still a lockdown, as you say.
It is.
will take Auckland to 7 weeks of lockdown. Are you of a mind to offer more support from central government, whether it's handouts or mental health support, or what more can be done, because people up there are getting obviously so much?
Thank you. A good reminder for me to again mention of course, a lot of the mental health support that's provided at this level is often remote, but a reminder of 1737 youth line for our rangatahi. And we do have particular support offered to our businesses and small businesses through Business Connect and often through our chambers as well. So please, anyone needing support, either practical financial support as a business or just support to get through, please do reach out to those services. You will have already seen that we made a move that is a big step change from our original lockdowns around the way we're using the resurgence payment. That in the past had tended to be a one-off payment. We've now put it on a regular cycle. Every 3 weeks, the resurgence payment, which can be used for fixed costs, like, for instance, lease arrangements or rentals, is able to be drawn down every 3 weeks. And, of course, the wage subsidy continues to be available for those who are affected by some part of the country being in those higher alert levels. And that allows some of those businesses who might be outside of Auckland but affected by Auckland, so it will mean events or tourism businesses are able to access that support if they can meet that criteria. We do, however, constantly keep under review the needs of those particularly affected by these restrictions, and that's something the Minister of Finance is constantly assessing where our supports are hitting, if they're reaching those we needed, and if there's anything else we need to do.
And so we're going to break away from the news conference now, but as always you can keep watching on our website newshub.co.nz. A lot of information, so let's recap those key points. The Prime Minister has confirmed Auckland will move into Alert Level 3 at 11:59pm tomorrow night and will stay at a Level 3 for at least 2 weeks. Those settings will be reviewed by Cabinet on Monday the 4th of October. The rest of the country will stay in Level 2, but the limit on gatherings has increased from 50 to 100. Despite the level change, the Prime Minister is urging Aucklanders to be cautious, reminding people that the bubbles remain in place and you are not allowed to visit friends or neighbours. Some minor extensions to bubbles are allowed, but only to bring in people who are isolated or vulnerable. Businesses can open, but only in accordance to strict rules. And Jacinda Ardern is urging people to keep working from home if possible. Schools remain closed except for the children of essential workers, and face coverings will now be mandatory at all Level 3 high schools. Meanwhile, the Director-General of Health is issuing a Section 70 notice for the area around Whakatiwai south of Auckland's border, where 3 new cases were reported today. That means everyone who lives or works in the area must stay home and monitor for symptoms for the next 5 days. There were 22 new cases today. 5 of them are yet to be linked.